Have you ever heard of diabetes? Most have, but few are aware of the specifics. Today, we are talking about type 1 diabetes. Type 1 diabetes is an autoimmune disease. An autoimmune disease occurs when an immune system attacks a body's healthy cells, organs, or tissues. For type 1 diabetes to occur, a person's immune system attacks cells in the pancreas, an organ that produces insulin. Insulin is the body's tool for breaking food or glucose down into fuel. Type 1 diabetes is often called juvenile diabetes, but it is not just children who can be diagnosed with diabetes. This is a common misconception. It is important for those of all ages to know the symptoms of type 1 diabetes, as the knowledge can be life-saving. Symptoms can include increased thirst or hunger, weight loss, mood changes, frequent urination, feeling tired or weak, and blurry vision. Type 1 diabetes can occur at any age. There are treatment options for all age groups, but most commonly used is the insulin pump and continuous glucose monitoring system, or CGM. A CGM can be worn on the arm or stomach and checks the blood sugar of the patient every 5 minutes. This data is sent to the insulin pump through Bluetooth, allowing the patient to easily monitor their blood glucose levels. Not treating your diabetes can lead to many complications, such as kidney damage, eye damage, foot damage, and heart and blood vessel damage. Once the damage is done, it is very hard for your body to recover. Thankfully, technology has improved to make treating diabetes easier now than it has ever been. Only 62 years ago, in 1963, insulin pumps were the size of a microwave and worn in a backpack. Now, insulin pumps are much more manageable and smaller sized. Type 1 diabetes can be genetic, but it can also appear out of nowhere. The CDC reports that 4% of people diagnosed with type 1 diabetes are 18 to 44 years old, and it is more likely to occur in men. Although it is not as likely for someone above the age of 14 to be diagnosed with type 1 diabetes, you never know what could happen, and being prepared could save a life.